Within schools, using methods that align with research is really an essential part of complying with the Individuals with Disabilities Education Act. And we want to be using techniques and methods that have been accepted and supported by peer-reviewed journals or approved by expertise. So we want to be using methods along the way that are supported for sure to ensure that our students are making effective progress. However, evidence-based practice has been talked about in recent years as involving more than just peer-reviewed journals. So in this course, I also want to be talking about how we can be looking at other factors in order to demonstrate that we are operating from a base of evidence. There is also a lack of evidence around language development. We're still looking for that and still wanting to have more research supporting our methods. So sometimes when we're looking for evidence, it can be hard to get in terms of looking at the research base. ASHA's evidence-based practice model is really helpful in supporting our view of evidence and what really constitutes evidence. And it's based on models within psychology where our research doesn't often consist of things that really support the medical field and interventions within medical fields, which often involve more like double-blind studies, etc. But ASHA encourages us to think within the model that includes the current best evidence, so that includes published studies, our own clinical expertise. So are we seeing an effect on a child's language based on this method? So taking data to support our use of a particular method or technique is essential to operating within evidence-based practice, so we can see how it's working and make changes if it's not, as well as client values. So when I think about students in the schools and I think about technology, one of the ways that technology is supported by client values is that our students tend to really like using technology. So if we can find ways to use technology in a targeted way, that goes along with this model as well.